to look at a topical issue that we often encounter in the practice or in the clinic, the issue of bad breath, mouth odor, which we call halitosis. This is a problem that affects people socially and even in their love life. Most often, people will come in and complain that they have bad breath, they have mouth odor. And often, we have to do something at least to help them to alleviate this problem. Let's look at the causes of bad breath or mouth odor. There are so many factors that can lead to bad breath or mouth odor. But basic one is poor oral hygiene. Poor oral hygiene, that is unclean mouth, where we have a lot of stagnant food remain, plaque, calculus, unclean mouth generally, definitely will cause a bad breath, because most of these dirty things in the mouth, whether leftover food or plaque or calculus, are infested by germs in the mouth, bacteria, and we have millions of them in the mouth. And this bacterial activity causes some byproduct which result in this bad breath. So, first and foremost, in order to eliminate bad breath, we have to keep our mouth healthy and clean at all times. And of course, we have talked about the basic thing that we need to do in order to take care of this. That is our regular toothbrush and paste application. We have to clean with brush and paste most of the time. I mean, at least 2 times a day. And most important, before bed at night. This, at least to some extent, if bad breath is as a result of unclean mouth, then once we do this, we'll be able to take care of the bad breath. Secondly, diseases of the teeth and the gum can lead to bad breath. Well, if somebody has a very big hole on a tooth somewhere in the mouth, a big cavity or caries that is trapping food at all times, definitely this may result in bad breath. Unless this is flushed out, unless this is clean, most of the time, if the food that is trapped in there, of course, become rotten over time, and then, of course, doesn't smell nicely at all. Some people will even use all kind of things to pick out this, and they smell it or put their finger into the place, smell it, and they don't like the smell, and therefore come to the clinic to seek attention. Besides that, other things that can cause a bad breath are diseases that we can have in the throat or in the chest, or diseases other than in the mouth. If somebody has a disease of the chest, definitely, since the air that we breathe out comes from the chest, from the lung, definitely this can transmit as a bad breath. So if we have issues like disease of the throat, like infection of the tonsil that has been there for a long time, and then infection in the chest, especially the bad cases, and some other diseases in the body. People with diabetes, people with very serious issues of maybe cancer, kidney problem, liver problem. Most of these in a very bad state sometimes can cause bad breath. And how does some of these diseases, how do they lead to bad breath? If some of these diseases are there, sometimes the rate at which we produce saliva is decreased. If the rate at which we produce saliva decreases, Then this saliva most of the time moisturize the mouth and even flush away some of those things that are remaining in the mouth. But slow rate of production of saliva most of the time will lead to stagnation of all these food in the mouth, and then lead to bad breath. Also, in addition to that, what we eat. Sometimes we have some people who eat a lot of garlic, a lot of onion, even some people eat it raw. All this, we know that those things, when we eat it, people stand beside us or people are hanging around, they smell it. Whichever way we look at it, is still contributory to bad breath. So the food, what we eat, also is very important in the problem of bad breath. Now, we are supposed as adults to use mouth rinse regularly to take care, to prevent dental diseases and also keep fresh or good breath. Most of these mouth rinses are medicinal, they're antibacterial. We have a lot of them out there in the pharmacy shop and then in the corner shop and everywhere. Some of them do not contain antibacterial activity. And therefore, what do? They just mask the bad breath when you apply them. But the important one that we always emphasize is the one that has antibacterial activity. And we have a lot of them in the pharmacy shop out there. So when you use these mouth rinses or mouthwash, they decrease the activity of bacteria or even kill them. And once this is happening, most of the time, the bacteria, once they are not active, then issues of bad breath become diminished or become decreased, because it is the activity that is most of the time leading to what they produce the bad breath. Can you imagine most of us when we wake up in the morning and you just hold your palm and breathe into your palm and smell it? Yes, most of the time we will notice some form of smell even when we brush in the night before going to bed. Because over the night, we are not active, so saliva is not flowing freely. And once saliva is not flowing freely, the activities of bacteria is stepped up, and then this leads most of the time to increased activity and then increase bad breath. So in most of the cases, bad breath definitely affects social life, affects our relationship with other people, and in fact, it doesn't promote our love life. Therefore, when people have it, there's a lot they can check out in order to see what is the cause, and then, of course, when they come to the clinic, necessary advice or necessary intervention will be given, and then we can take care of this social malaise. So this is where we are going to round up this episode.